Hello everyone, welcome back to our channel. Today, we're delving into a topic that's been making headlines lately, monkeypox. In this video, we'll learn all about what monkeypox is, its symptoms, causes, and most importantly, how to prevent it. What is monkeypox? Monkeypox is a viral infectious disease caused by the monkeypox virus, which is part of the Orthopoxvirus family. It is primarily found in Central and West African regions. The disease can affect both animals and humans, causing symptoms that resemble those of smallpox, such as fever, headache, muscle aches, and a distinctive rash. Monkeypox is typically transmitted to humans through direct contact with infected animals, including rodents, or through close contact with infected individuals. Brief history of monkeypox? 1970s. Monkeypox was first identified in 1970 when outbreaks occurred in monkeys that were being used for research. The disease was named monkeypox due to its initial discovery in monkeys. 1971. The first human case of monkeypox was reported in the Democratic Republic of Congo, formerly known as Zaire, in a 9-year-old boy. The boy had a fever and a rash that resembled smallpox. 1970s-1990s. Monkeypox cases remained sporadic and were primarily confined to Central and West African countries. There were occasional outbreaks among humans, often linked to close contact with infected animals, particularly rodents. 2003. The largest outbreak of monkeypox to date occurred in the United States, linked to the exotic pet trade. Several individuals were infected with monkeypox after coming into contact with infected prairie dogs, which had been kept as pets. 2018-2020. Cases of monkeypox were reported in several African countries, including Nigeria, the Democratic Republic of Congo, and others. Current scenario of monkeypox outbreak. Since early May 2022, a large number of monkeypox cases have been reported from both non-endemic and endemic countries. Most confirmed cases with travel history reported travel to countries in Europe and North America. This is the first time that many monkeypox cases have been reported concurrently in non-endemic and endemic countries in wide geographical areas. About causal agent of monkeypox. The monkeypox virus belongs to the Orthopoxvirus family, which also includes viruses like smallpox and vaccination virus. Envelope. The virus has a lipid envelope that surrounds its outer surface. This envelope contains viral proteins and glycoproteins that are crucial for interactions with host cells in the immune system. Brick-shaped structure. Monkeypox virus is brick-shaped and relatively large compared to some other viruses. Its dimensions typically range from 200 to 450 nanometers. Core structure. Inside the envelope, there is a core structure that contains the virus's genetic material, which is double-stranded DNA. This genetic material encodes the information necessary for the virus to replicate and produce its components. How monkeypox transmits. Monkeypox primarily transmits through direct contact with infected animals or humans. Animal contact. The virus is usually introduced to humans through contact with infected animals, particularly rodents like squirrels, rats, and monkeys. Handling, hunting, or consuming the meat of infected animals can lead to transmission. Human to human. Once the virus infects a person, it can also spread to other humans through close contact. This can include physical contact with infected skin lesions, respiratory droplets from coughing or sneezing, and contact with contaminated clothing or bedding. Indirect contact. Indirect contact with surfaces or objects contaminated with the virus can also lead to transmission. For example, if an infected person touches their rash and then touches a surface, the virus can survive on that surface for a period of time, allowing others who touch it to become infected. Medical procedures. Healthcare workers and caregivers are at risk of contracting the virus if they come into contact with infected individuals' bodily fluids or contaminated medical equipment. How monkeypox virus cause disease, pathogenicity in human. Entry into the body. The monkeypox virus enters the human body through direct contact with infected animals or through close contact with infected humans. The virus can enter through breaks in the skin or mucous membranes, such as the eyes, nose, or mouth. Virus replication. Once inside the body, the virus begins to replicate. It attaches to specific receptors on the surface of host cells, particularly skin cells and cells of the immune system. Cellular infection. The virus enters host cells, hijacking their machinery to replicate its genetic material and produce new virus particles. As the virus replicates, it can cause damage to the host cells. Immune response. The immune system detects the presence of the virus and mounts an immune response to fight the infection. This response involves the activation of immune cells and the release of signaling molecules called cytokines. Symptoms. The immune response, along with the damage caused by the virus to infected cells, leads to the characteristic symptoms of monkeypox. These can include fever, headache, muscle aches, and the development of a rash. Rash formation. The rash in monkeypox starts as flat, red spots that later develop into raised fluid-filled bumps. This is due to the virus's effects on the skin cells and the immune response targeting the infected cells. As video showing similar kind of skin rashes produces by varicella zoster virus. Transmission. As the rash progresses, the virus can be shed from the skin lesions. This shedding increases the potential for the virus to be transmitted to other individuals through direct contact with the skin lesions or respiratory droplets. Recovery and immunity. In most cases, the immune system eventually clears the virus from the body. Those who recover develop an immune response that provides some level of protection against future monkeypox infections. It's important to note that while monkeypox can cause significant illness, it is generally less severe than diseases like smallpox. What are the symptoms of monkeypox? Monkeypox is a viral disease that resembles smallpox, but it's generally milder. The symptoms of monkeypox can be divided into two phases, the invasion phase and the eruptive phase. Invasion phase, 0–5 days. It include fever, headache, muscle aches, backache, swollen lymph nodes, chills, exhaustion, sore throat, and dry cough. Eruptive phase, rash, 1–3 days after the onset of fever. Rash is the most recognizable symptom of monkeypox. The rash typically begins on the face and then spreads to other parts of the body. It progresses from macules, flat, discolored spots, to papules, raised bumps, to vesicles, fluid-filled blisters, and pustules. Eventually, the lesions crust over and scab. Lesions can also appear on the mucous membranes of the mouth, nose, and genitalia. The rash and accompanying symptoms generally last for 2 to 4 weeks. The disease is usually self-limiting, which means that most individuals recover without complications. However, in severe cases or among individuals with compromised immune systems, monkeypox can be fatal. How to diagnose monkeypox? Because the symptoms of monkeypox can resemble those of other diseases, including smallpox and chickenpox, an accurate diagnosis is crucial. Clinical evaluation. A healthcare professional will start by examining the patient's symptoms, including the appearance and progression of the rash, as well as any associated symptoms like fever, headache, and muscle aches. Polymerase chain reaction, PCR. This technique amplifies and detects the genetic material of the virus in patient samples like skin lesions or respiratory secretions. Virus isolation. Attempts are made to culture the virus from patient samples in a controlled laboratory setting. Serology. Blood tests can detect the presence of antibodies specific to the monkeypox virus. Travel and exposure history. Information about recent travel to endemic regions or contact with animals known to carry the virus is essential for a comprehensive diagnosis. Consultation with experts. Due to the rarity of monkeypox, consulting with experts in infectious diseases, virology, or public health may be necessary to ensure a correct diagnosis and proper management. Accurate diagnosis is crucial not only for providing appropriate care to the patient but also for public health purposes, as monkeypox is a reportable disease in many countries to help prevent its potential spread. If you suspect you may have monkeypox or are experiencing symptoms consistent with the disease, it's important to seek medical attention promptly. Healthcare professionals can conduct the necessary tests and provide guidance on appropriate treatment and management. What is treatment for monkeypox? There is no specific antiviral treatment specifically approved for monkeypox. However, supportive care and management of symptoms play a crucial role in helping patients recover from the disease. Managing of monkeypox symptoms include maintaining hydration through oral rehydration, managing fever and pain, cleaning skin lesions using mild antiseptics, isolation of patient, prevention of secondary bacterial infection and continuous monitoring of the patient to prevent further complications. How to prevent monkeypox? Avoid contact with infected animals. Refrain from handling or coming into direct contact with animals known to carry the virus, such as rodents like squirrels and rats. Avoid consuming the meat of animals that could be potential carriers of the virus. Practice good hygiene. Regularly wash your hands with soap and water, especially after being in contact with animals or animal products, and after caring for sick individuals. Avoid touching your face, especially your eyes, nose, and mouth, with unwashed hands. Isolation and quarantine. Individuals diagnosed with monkeypox should be isolated to prevent transmission to others. Close contacts of infected individuals might need to be quarantined and monitored for symptoms. Personal protective measures. Healthcare workers and caregivers should use appropriate personal protective equipment when caring for patients with monkeypox. Smallpox vaccination. The vaccinia virus-based smallpox vaccine has been shown to provide some cross-protection against monkeypox. People who have received the smallpox vaccine in the past might have a reduced risk of severe monkeypox or even infection altogether. However, smallpox vaccination is no longer routinely given, so this protection might not be widespread. Public health measures during outbreaks. In regions where monkeypox is prevalent, public health authorities may implement measures such as contact tracing, isolation of cases, and public awareness campaigns to prevent the spread of the virus. Healthcare infection control. Healthcare facilities should implement proper infection control measures to prevent transmission among patients and healthcare workers. Vigilance and surveillance. Monitoring for monkeypox cases and outbreaks is essential for early detection and containment. Conclusion? To sum it up, monkeypox is a viral disease with symptoms resembling smallpox. It's primarily transmitted through animals and can spread among humans. Remember, prevention is key. By avoiding contact with infected animals, practicing good hygiene, and considering vaccination, we can significantly reduce the risk of monkeypox outbreaks. That's all for today's video. If you found this information useful, don't forget to like and subscribe to our channel for more informative content. Stay safe and informed, everyone. Thanks for watching.